Assalamu alaikum. Starting our communication day, we have Mr. Oliver. He's 57 years, complained of productive cough and short of breath for last 2 months. He sought medical advice with his GP 2 months ago and treated him as viral infection. Symptoms sustained since that time. Recently, chest X-ray was done for him and revealed left upper lobe mass. Further CT chest, abdomen, and pelvis with contrast revealed lung cancer with metastasis to the liver and bone. You are senior house officer of the outpatient clinic, chest clinic. You have to ask. You have been asked to discuss the result with Mr. Ali.
Yes, ready, Dr. Bas.
Yes, hello there. This is
Hello.
Dr. Mukhtar, the doctor in the chest clinic today. You are, you must be Mr. Oliver. You are 57 years.
Yes, doctor.
Yeah, we are here to discuss about your health issue. Is that okay for you?
Yes, doctor. Sure.
Okay, Mr. Oliver, you want anyone to attend our meeting?
No, no, doctor.
Okay. Can I ask you what you know so far about your condition?
Yes, doctor. I have this problem with my chest. I feel my chest is not good since 2 months, doctor. I have cough and I feeling sometimes short of breath. I sought medical advice many times. I receive paracetamol. I don't know. This time we do for me some imaging. I came for result, doctor. What is this, doctor?
Yeah, I appreciate your knowledge about your condition, Mr. Oliver. Can I ask you what's your expectation about this result?
I don't know, doctor.
طيب
Okay,
فكرتك انك
I
ماشي.
appreciate
السلام عليكم. وعليكم
your
السلام ورحمة
concern.
الله.
I appreciate your knowledge about your condition, and let me explain to you what have been appeared in your scans and in your tests. That okay for you?
Yeah, please, doctor, explain.
Okay. Uh, Actually, the scans of the chest and abdomen, tummy, and your body shows that you have, I'm afraid to say, you have a cancer in your chest.
What, doctor? What? Doctor, are you sure?
Yes, I'm so sorry to be the one delivering this news to you, Mr. Oliver. And we are 100% sure before delivering such kind of information to any patient.
Oh my God, doctor, this is bad news, doctor.
Are you okay, Mr. Oliver?
How
You
can
want
I be
some?
okay, doctor? You said me cancer. I'm not okay, doctor.
I'm so sorry for that. You want some tissue or water?
Uh, yeah, please give me water. But doctor, I go. Why my GB? I sought medical advice before 2 months. That time I visit my GB, he didn't give me anything. He didn't tell me anything. Just he give me, uh, I think, paracetamol or what.
Yeah, I appreciate your concern, Mr. Oliver. Actually, I'm not sure about the result that time and if was seen by a scan doctor. Uh, anyway, you can have a chat with your GP and you can ask him more about the result and about the situation that time. But about today, the result, as I told you, there is a cancer in your lungs. And let me tell you also, this cancer has been spread to other areas in your body. I'm sorry also to
Oh
say
my
that.
God, doctor. Okay, doctor. Doctor, did you think if my GB give me this news as early, did me change my prognosis, or can I receive a good treatment?
I appreciate your concern, Mr. Oliver. Let me tell you that if within 2 months, it's not logic that the cancer would be spread. It suppose it would be spread since that time and it wasn't discovered. So within these 2 months, I think it's no matter about the time. It was already spread before. You
Yeah, doctor.
understood me.
Yeah, doctor. Okay.
Okay,
I see.
Mr. Edward, can I ask you some question?
Yes, doctor.
You want me to explain more about your condition?
Yeah, please, doctor. Please explain to me.
Yes. According to the scan did for your body, the cancer was spread, as I discussed with you earlier, to the liver and bone. Makes the prognosis or the outcome of your cancer not good as we hope.
Yes, doctor.
Are you following me?
Yes, doctor.
So in this condition, we will refer you to our group of doctors. They are professional. They will sit with you and they will tell you about further management plan. Is that okay for you?
Okay, doctor.
Okay. Mr. Edward, I can ask you some question. With
Yes,
whom you are
doctor.
living?
Uh, I'm living alone, doctor.
Okay. And anyone dependent on you?
No, doctor.
Any kind of support you need at home?
No, no, doctor. I'm okay. I'm fully supported.
Okay, Mr. Edward. As I have been discussed with you, our group of doctors will sit with you, will tell you about further management plan. Mostly the team will be called as palliative care. Did you
But why,
hear
doctor?
ever?
But why, doctor? Why, doctor? Why this my diagnosis is delayed? Why not reach a diagnosis early, doctor?
Uh, I appreciate your concern, Mr. Oliver. Let me tell you about the cancer nature. Cancer nature in real life, they appear like hidden nest growth, and it's growing so fast. And once some of these cancer, once discovered, mean that it's spread all over the body. Most of the cancer doing that. Did you understand that?
Yes, doctor. But oh, okay, doctor.
According to your letter, you have just the complaint or the symptoms 2 months back, and basically before these 2 months, the cancer growth have been grown inside your body, but most probably that you didn't have any symptoms. You
Okay,
understood that?
yeah. But
Yeah.
doctor,
Uh,
my GB, he didn't diagnose me early. I'm very sad, doctor, from my GB. I need to complain my GB, doctor.
yes, I appreciate your concern, Mr. Oliver, and it's totally all right to complain him, and I can refer you to the GP surgery. You can contact him and you can complain about your GP. Is that okay for you?
Yes, doctor.
Okay, Mr. Oliver, can I ask you, do you smoke?
Yes, I do, doctor.
And do you drink alcohol?
No, doctor.
How many cigarettes you are smoking, Mr. Oliver?
10 cigarette per day, doctor, for last 10 years.
Yeah, let me tell you and inform you that the smoking has a big role in the most of the cancers, especially the lungs cancers. So it might be the reason behind your cancer. And I can advise you to stop smoking to slow down the growth of this cancer inside your lungs. That okay?
Yes, doctor.
Okay, what's your job?
Uh, doctor, actually, I'm retired. Policeman
Have
retired.
policeman. Okay, you have been exposed to any some in this industry or factory.
No, doctor.
Okay. I will hand you some leaflet brochure about the palliative management and the update about your condition to read more about it. Is that okay for you?
Yeah, doctor, okay.
You have any other concern?
There is no hope, doctor. Time
Okay.
over.
Yes, time is up. Okay. Let's reset the time and start the comments.
Okay, Dr. Basim, Dr. Basim. Actually, my scenario is angry patient for delaying diagnosis. This is the main issue. يعني this from scenario إنه delay diagnosis. Here we need from you as you mentioned يعني the result of the after introduction you need to mention the result of the blood investigation. Huh? Please mute.
Yeah, I'm muted already. Yes, go ahead.
Uh, we need to set the result of, blood investigation and imaging have been released, and I'm sorry to tell you, as not as we hope. We need a silent here, يعني silent a warning shock. You need to tell me there is what happened, doctor. You will say to me there is cancer in your lung, and I'm sorry to, yeah, this is to be seem to be advanced. You said this and spread to the other organ. Stop for a while. Then the patient, and as I said to you, doctor, why, how can this happen to me? Already I sought medical advice before 2 months, and my GP give me just like this. If he discover this early, can you tell me all about this? Then we need from you to showing empathy and sympathy. I'm really sorry for this bad news. I highly appreciate your feeling, but be sure we are here for you. The most important here point from you, we need to to manage to manage the concern of the patient. And why this came? Why is delayed diagnosis? Here we need to just to said to the patient there is many disease could mimic each other and maybe present with similar symptoms and assume the mostly when you presented at that time to the GP with mild symptoms and without alarming symptoms. I mean, يعني no indication for further investigation. And as you said to me, I ask you, يعني you said to me, majority of the patients with cancer are diagnosed lately with advanced stage. Here also you need to said I am not defending on my colleague, but I'm trying to explain the situation which are facing a lot in our medical field. However, we are going to check your file and to contact your GP to find the whole situation. And be sure if you found any negligence, we are going to investigate seriously. Then you will go for يعني I will refer you to the Macmillan nurse, cancer doctor, lung doctor to decide for you the proper treatment. Just like this, sympathy, then social. This is a scenario. يعني the main concern here to convince the patient there is maybe there is some disease can share same symptoms. And when you came to the GB, maybe with mild symptoms, and that time there is no any alarming symptoms like weight loss, like poor appetite, to search for يعني go for deep investigation. Then you contact the GP and to know the whole situation, and you will say to the patient, if I found any negligence, I will investigate it seriously. This is all scenario. By the way, this scenario from Morocco, يعني I bring from Morocco والله. I think
Yeah,
this
yeah.
scenario is very common.
Yes, sure, sure.
Yeah, delayed
Dr. Aisha
diagnosis.
added,
There is
yes,
there is bring also, I think, before 3 days or 2 days, delayed diagnosis of Pheochromocytoma. We
yes,
consider it,
yes.
I think, as white
But
coat
that
hypertension.
scenario was 6 months, and this scenario is just 2 months. That's
Yeah,
why
well,
I
yes,
couldn't consider as delayed. Anyway,
yeah.
yeah.
No,
Okay.
just يعني you did well, just apart from يعني delaying, why you delaying يعني. Just we need from you to
Mm.
add this يعني to the your as you're talking, just to add this. There is many disease can mimic each other and maybe present with similar symptoms. And assume when you presented to the GP at that time, you presented with a mild symptoms يعني no alarming symptoms, and we will contact the GP and we know the all station. And as you tell me, the cancer usually present in advanced stage, just like this.
Yeah, yes. Yeah, I agree with you, Dr. Ali. Let's read the comment. Also, Dr. Roda has commented, GP delay. I am not aware of the circumstances there. I will contact him and get answers. So for this point, Dr. Roda, I think I am not the one who will be doing that. I can ask him to go back to him and to have the explanation for his symptoms and what happened and the situation. Cough and shortness of breath, common symptoms seen by GP on regular basis. Yes. Usually we think of cancer if certain symptoms happen, like weight loss, lumps, or coughing blood. Yes, agree. So they are not usually go to doing CT scan or exposing patient to radiation. GB deals with common symptoms and hence viral infection is on top of their list. Not like us, the chest physician, we may put cancer area on the list. I agree. Okay, Dr. Aisha also, thank you, Dr. Roda, for your comment and these advices. I agree apart from the first one. I can ask him to do that. Not me, the one will do that. Or at least to refer him to the GP surgery and the concerned office for this type of complaint or problems. Smoking or alcohol history not appropriate here. I agree, Dr. Aisha, but I try to explore to him the cause of his cancer. So I asked him about smoking. In other scenarios, if already patient for palliative and another cancer, I mean, suppose I will not tell him this point.
Yeah,
This
because
is
you didn't mention in your scenario. I think if nothing mentioned in your scenario, no need to talk about it. يعني now, no, يعني the task.
the palliative.
Yes.
Yes,
But we should
Yeah,
I
not blame
think
the patient in our scenario. We don't know
it's not
exactly if the
it's
cancer
not
related or
blame.
not.
No, it's not blame, Dr. Aisha.
no,
It's a
not
kind of
blame the, not
explanation.
Usually don't
blame.
ask about social except you will advise for something. If it, you will take action. If no
Yes,
action for social, don't ask. This is the
no,
rule.
no. What do you mean by not blame the patient? Not blame the patient or doctor?
The
No,
patient
she
about
mean
smoking. That's the
she mean I am
smoking
not
is the
blaming. I
cause.
am just exploring to him the
Don't
cause of his
explore.
cancer.
Uh,
Don't explore in this scenario because already he have very bad news and he is angry and no any benefit to stop smoking now.
Okay, and I agree in somehow. It's okay. Thank you, Dr. Aisha. Yes, you're right. It was
For the point about GB, just you
yes.
will also comment this is a valid concern, and I can help you by advising like you will go to the office, LS, but you will also define your college. I don't know exactly what's happened, but for like Dr. Radwa, somewhat just less
Yes,
than
yes,
1
yes.
minute you will talk.
Yeah.
Really, your symptoms not suspicious for anything. If you have any cough of blood or any loss of weight or any lump anywhere, we can't diagnose this easily. But we will investigate, and if we saw any negligence, you have full right to complain. Yani,
Yes, yes.
I think you will not talk deep, but also you will accept his concern. It is a valid, but just you will write like one sentence that our doctors do the best to manage his condition, but your condition really maybe not suspect the doctors that you have cancer. I think
But
this
sorry,
is just
Dr. Aisha, you need here if the patient he has a full right to complain. When the patient he said I need to complain the GB, you will set first, يعني the first answer you will set this is your full right to complain.
yes,
If
yes,
you said like this mean you're defending about your colleague. Here, يعني you tell the patient already, I didn't know the situation. I will contact your GB. I will find the whole. Even I will check your file. I will know the whole situation. And if I found any negligence, I will investigate it seriously. You tell
but the
the
doctor,
patient
the
this.
one do that.
In
The
spite
doctor
of
will
that,
contact the
patient he
GB
said
and investigate. I think
yes.
No,
not
no, not
him,
the doctor.
not
GP
the doctor.
surgery.
No,
He
no,
will
not doctor.
complain, then they will investigate if this is
Yes.
negligence or no.
No, no,
So
no.
you are not the one will investigate and see
How
if there
you
is
manage the
negligence.
dilemma معلش دكتور عائشة, how you manage the dilemma or the concern of the patient. يعني the patient he come to you the first concern, doctor, why our GB he didn't diagnose me with the last 2 months. You will say to him, يعني as I said, this is as I said, you will say to him first, yeah, there is some disease share same symptoms. And I
Yes,
assume that when you presented to the GB that time there is no alarming symptoms, and you come يعني you present with common symptoms, I mean, or mild symptoms like just يعني no alarming symptoms like weight loss, like poor appetite, like coughing up of blood. Another things, the cancer usually present in advance and maybe discover late usually. Also, I need to reassure you, I will contact the GB and will even I will see your file and will see the whole situation. And if I find any negligence, I will take يعني it seriously. Here you answer the patient, and here patient will trust you.
I
But
agree the
when
first part, but the other part
yes,
you will guide. If you insisted about complaint, I'll guide you for BLS. This is the one
yes, you
they
will guide him.
investigate,
He is full
not
right to
you.
complain.
You have no right to contact the GB and ask him what he did. No right to talk to another doctor and ask him why you didn't diagnose what is the symptoms the patient will come. What is the right for you to contact other doctor and ask him about this?
Yes. There is another authority that can do it. The GP
Yes, and
surgery.
also this is for us it is opinion. May I am a clever doctor. May I suspect you are not clever like that. But the authority is specialized in these situations, and they have characteristic of negligence, and some characters they will investigate, and it is like
Who will contact? Who will contact?
the BLS,
GP surgery.
the patient
No, no,
advice.
no. It's not
Please.
PALS. It's not. It's GP
No,
surgery. GP
no,
surgery.
don't. I think don't
This one.
GB
speak. يعني
surgery. What is
Yeah.
GB?
This GP surgery.
دك-
This office concerned to
دكتور
the
باسم.
Ah,
GP family
GB.
medicine in UK. Yeah.
Ah,
GP surgery.
Yes, yeah, دكتور باسم. I
Yes.
answer all this question from الرخ direct. يعني I bring this scenario from الرخ. I didn't
hmm.
bring from anywhere. يعني this is الرخ managing the dilemma of delayed
And he
diagnosis.
writes like that. You will contact the GB.
Yes, see what he mentioned. what he mentioned, what is the point? Main the point. He mentioned many diseases could mimic each other and may be presented with similar symptoms. I assume that mostly when you presented at the time with mild symptoms and no and without alarming symptoms, which indicate further investigation. Majority of the patients with the cancer are diagnosed lately with advanced stage. I'm not defending my colleague, but I'm trying to explain the situation which we are facing a lot in our medical field. However, we are going to check your file. يعني we are going يعني group here, not him. We are going to check your file and to call your GB to find our all situation. I promise you or I reassure you, if we found any negligence, we are going to investigate seriously. It's that okay with you? Yeah, patient will trust you. Yes. Then we will go for management plan. We will refer you to the team. Then you will like this. Embassy, then we'll go for social. But this is the main concern. This is even a medical error. When you face the medical error, you will tell the patient a rule of A. When you finish, the patient first concern, he will tell you, doctor, I need to complain. Even when you solve the problem, he will tell you, I need to complain. You will tell him, this is your full right to complain. And even if you need help, I will guide you to the patient, اللي هو advisory liaison service. يعني you not here we you said we are going يعني is your group not you alone. I
Dr.
bring this
Sarah,
answer from Arroch direct.
yeah, okay. If Dr. Sarah present, you can ask her as she's working there. No, she's not. Okay. We will review it, Dr. Ali, because what I remember, this is also the job of surgery, GP surgery. This is the officer handling the problem with the GP, not the PALS. PALS is the office and the hospital for the hospital problems. So we can review this scenario, and you can share with us also the feedback of okay?
Yeah, okay, I will tell you the number of Arroch. I think scenario 114. If you need, I will
Okay.
share in the group. Okay, I will share the. Wallah, I think this
Okay.
scenario I bring because it's a good scenario. Maybe يعني طيب
Yes,
delaying
yes.
diagnosis.
Yeah,
Okay,
it's
then I
conflicting scenario. How to talk about you will consider as medical error or not error. Yeah, it's
no
debateful
medical error here.
scenario. Yes, no medical error. Yes, I agree. Yes.
Yes, yes, no medical error. Okay, I answer. I
Just
send the
to be sorry for the patient that he has suffered all of this
because
and
you
he
don't
has
know the
been
whole
late.
situation. As he said, يعني you don't know the whole situation. And when
Yes.
he presented that time, what is the symptoms or what like this? يعني.
Mhm. Yes, you're right. So,
I I share the note in the group.
okay. Okay, I will prepare your scenario. I will write. Actually, I want to practice the Pheochromocytoma scenario, delayed diagnosis as well.
No problem. Is good.
Yeah, to be the same topic. If anyone has this scenario, he can share with us. I am searching for this scenario to be more clarifying the
This
debate
scenario
about
patient present with the white coat hypertension.
hypertension, and he's
and
he-
and he gives the patient antihypertensive treatment, but the patient he didn't respond. Then
if you have the scenario, share it. You have the
والله
scenario, you can share it.
I don't know. I will maybe this I think scenario of Dr. Hussam. I will see if I have. I will send in the
Yes,
group.
yes. Okay.
Then I will see where is Dr. Hussam. Yes, Dr. Basim.
You have it?
Wallahi, I find, yeah.
Okay, share it. I am intended to do similar scenarios and topic in the same session to clarify the topic itself.
See, this scenario,
Yes.
patient Mr. John, 35 years old male. You are ST3 in hypertensive clinic. Mr. John had high blood pressure for the last 5 years with frequent intermittent episode of mild headache.
Excellent. Yes, this
Okay?
is the one. Yeah.
Yes. See many time by GB and tried many medication for hypertension, but his BP has been difficult to control. He was also having symptoms of anxiety for his GB diagnosed him as white coat hypertension and prescribed the azepam. As his blood pressure was not controlled, his GB referred him to your clinic 2 weeks ago and he underwent several investigations. Urine high metanephrine CT adrenal 5 centimeter. The diagnosis of Pheochromocytoma was confirmed. Mr. John already know about the diagnosis and need for surgical treatment was explained by endocrine surgeon. Mr. John feels that there is delay in the diagnosis. Please speak to him and address any concern. Allah ya akhi,
Yes.
good you bring this scenario now.
Yeah, yeah. Take
Nice.
2 minutes, then you can start. Thank you for sharing the scenario.
No, welcome. Hello?
Yes, ready?
Yes, Dr. Bas.
Yes, here you go.
Hello?
Yes, hello.
I'm Dr. Ahmed, one of the doctor in hypertensive clinic today. I spoke to the Mr. John, 35 years old.
Yes, doctor, I am.
Yes, Mr. John, we are here to discuss some issue related to your health status. Is that okay with you?
Yes, please, doctor. I'm struggling with my GP for this.
Yeah, Mr. John. Before I proceed further in my discussion, can you tell me what do you know about your condition so far to be on the same page?
Yeah, doctor, what I know that since 5 years I'm suffering and struggling with my GP. Every time I go to him, I went many, many times, doctor. I have the same symptoms, I have the same headache and anxiety, and whenever I go to him, he just reassure me and he gives some medication. It just make me calm, but the same blood pressure is still high. And again, I go to him, again, he's the same prescription. I don't know what's happening with him, doctor. Is he a doctor?
But here patient know everything, they even know the diagnosis.
Sorry, hypertension. I have hypertension, doctor.
No. قال لك Mr. John already know about the diagnosis and the need for surgical treatment. يعني he knows the
Yes.
diagnosis was confirmed. Mr. John know about
No,
the
no,
diagnosis.
no. The pheochromocytoma just released here in your hospital.
No, دكتور باسم معلش read the scenario again. قال لك Mr. John feel there was delay in diagnosis. Please speak to him and address concern. يعني already Mr. John already know about the diagnosis. خلاص هو عارف، يعني انت عارف انه الدياجنوز حقك فيه كروموسايتوما. الايشو حقك انت واي ذا جي بي ميك مي ديلي، يعني ليه تاخر في الدياجنوز حقك؟ ده المين ايشو.
See. The 2 weeks only. 2 weeks. Patient at the GP. I went to the GP clinic and investigation done. Okay, showed that all these results already knows about the diagnosis and the need for surgical. Okay, so yes, the diagnosis of
Yes, yes.
pheochromocytoma was confirmed. Yes, I didn't understand that it will be already. I
Yeah,
know
no
that the
problem. Yes,
diagnosis. Yes, okay. Let's restart again.
yes. Mr. John, we are here to discuss some issue related to heart cells. Is that okay with you?
Yes, doctor. Sure.
Before I proceed further, can you tell me what do you know about your condition so far?
Yes, doctor. I know that since 5 years I'm going to my GP for high blood pressure, and he was just giving me some medication for the anxiety. And again, I went to him, and he's telling the same problem. I have some anxiety and some blood pressure related to the office, the GP office, I mean. And he called me, he told me that it's white coat syndrome. Then when he referred me to your hospital, I surprised and I was shocked when I hear the diagnosis. It's a different condition and a different diagnosis and different disease. So what happened, doctor? Why all this time to diagnose my condition?
Yeah, Mr. John, firstly, I'm sorry for what happened to you, and thank you for sharing me this information. Actually, Mr. John, your concern is very valid. You're suffering from this high blood pressure many years, and your GB many time he treating you as high blood this white coat, because this is when you I think I'm not no knowing all the situation, but I'm thinking your GB he think about the common. This is why when you compare white coat hypertension to the pheochromocytoma, you will find white coat is a very famous. Other than this, pheochromocytoma is a very rare disease.
Doctor,
Also, also I need to reassure you. Yeah, when the GB he facing difficult to control his your blood pressure, he refer you to the to us to hospital.
after five
What?
years, doctor, after 5 years, he just now referred me to you. Why he didn't refer me since before, doctor? I think he neglect me, doctor, and for for that I will complain him.
Your concern is very valid, Mr. John. Actually, to be honest, I'm not know all the situation, but as I tell you, he give you the management one step, يعني starting the management, and when he facing difficulty to controlling your blood pressure, he refer to the hospital. Second, this is your full right to complain, and even if you need any help, I will refer you. I will advise you regarding this office complaint. Also, I need to reassure you, I will contact your GB and will check your file. I will know the whole situation, and if I find, if we found any negligence, we will take it seriously. We will investigate it seriously. Is that okay with you?
Yes, doctor, please, please, doctor. I think he has neglected me for all this time. I want to
Uh,
complain him, doctor, by any way.
yes, this is your full right. As I said it to you, we will see and we will investigate if you found any negligence. Is that okay with you, Mr. John?
Okay, okay.
Uh,
What you will do for me, doctor, now?
yeah, actually, Mr. John, now we assist you after our consultant now is assessing you, and now he is even he involves a surgical team, and the best management now for you is to remove uh, this mass located above your kidney. As you know, already we discussed to you this pheochromocytoma.
Yes, doctor, I heard about it.
Yes,
So,
this
doctor,
is. Let me just explain some few points for you.
okay,
To clarify, this pheochromocytoma is there is abnormal growth located above your kidney. This is secretes some protein called adrenaline. This is produce symptoms that you have. Now the treating team decide for you is the best to remove this. Is that okay with you?
yeah, doctor, if the blood pressure will be controlled, I agree. What do you
Yes.
think, doctor?
Uh, yes, your concern is very valid. Firstly, we need to control your blood pressure by 2 weeks before this operation. You can stabilize your blood pressure by giving you a specific medicine, and we will follow you. Is that okay with you?
Okay, doctor.
Do you have any other concern?
Uh, yes, doctor. Any chance of this disease to be recur back?
Mr. John, I highly appreciate your concern. I need to reassure you, mostly patient after the surgery will be fully cured. But also there is a few chance to be the disease will come back. But I need to reassure you, mostly will become a cure. Do you have any other
Okay,
concern?
how percentage, doctor, the recurrence rate?
To be honest, I'm not sure about the percentage. But this disease running sometimes there is run in family, sometimes maybe uh, uh,
Okay, doctor,
uh,
this is another point I want to ask you, doctor. Any chance my kids will have this disease?
yes, your concern is very valid. I need to tell you there is chance your kids to get this disease because there is familial pathway for this disease.
How
Sometimes
chance you mean, doctor? How percentage of this chance?
I think 10%.
Okay, okay,
Do
doctor.
you have do you
Uh,
have another
I
do you have another concern?
no, doctor. When you will do the surgery for me?
As soon as possible, when you control your blood pressure, you will do the surgery immediately.
Okay, doctor.
Okay. Uh, can I ask some question?
Sure, doctor.
What do you do for living?
I'm accountant.
Yeah. What does this symptom affect your job?
Sure, doctor. Whenever I'm stressed, I have these symptoms.
Yeah. Do you smoke?
Yes,
Okay. How many cigarettes per day?
on 10 cigarettes for the last 10 years.
Yes. I advise you to stop smoking because it's bad for your health. And even if you need help, I will refer you to the smoking cessation clinic.
Okay,
Uh,
doctor. Thank you.
do you drink alcohol?
Socially, doctor.
Yes. Okay, Mr. John, I will give you some brochure and some website to read more about your condition. Is that okay with you?
Okay, doctor.
Okay. Uh,
Do you need
okay.
anything from me, doctor, now?
I think if you agree for surgery, you need to be assigned a consent.
Yeah, excellent.
Uh,
Okay.
this consent should be should involve all information, and will the surgical team will explain to you everything about this consent.
Okay, doctor.
Is that okay with you?
Sure, doctor.
Okay.
Any other social you want to ask?
Are you financially support?
Yes, I'm working, doctor. I told you.
Yes.
What
I don't
else?
know.
Any
You
support
know.
at home? Who's living
Yeah.
with you?
Yeah. Who is living with you?
Yeah, okay. Yeah, I'm living with my partner.
Yes.
She's supporting me.
Yeah. He's supporting you.
Yes.
That is great. Time.
Okay. Okay, time is up.
Yes. Thank you for sharing this.
Yes, I think you cover it well. Apart from the point of GP, yes, you try. Sorry, you try to defend him, right?
Yes. No. I didn't defend
And
him.
it's clear here that it's delayed for 5 years. I think it's a very long time to diagnose
Wallahi,
pheochromocytoma.
Dr. Basim,
Mhm.
I writing this with Dr. Hassam. Wallahi, I now I open
Yeah.
my book, I find all.
Uh-huh. Okay,
I
so let's
write.
let's run the scenario from the beginning. So you will ask the confirmation data, the knowledge about the condition and the expectation. Then you will explain to him what about the pheochromocytoma, and he will insist again to complain, and he is assuming what happened is delayed diagnosis. Even you will try to convince him, he still is insisting that it's a delayed diagnosis. I think he had the right, because 5 years is too long to diagnose pheochromocytoma, especially if the symptoms is recurrent, and he will go back to his GP without referring him to you. So I think this is the delayed diagnosis, and it's a clear medical error. Although it's not your error, however, you can apologize, or you can say, I'm sorry for what happened to you, and some sympathy and empathy, because he's still angry patient. Try to be sorry for him until you absorb his anger. Then, if he insists to complain as you did, you can refer him to the office responsible for that. I think again it's the GP surgery, and he can file the complaint there about his GP. Yes, 100% sure and agree that you weren't there that time to have the whole circumferences of us, the whole circumstances of the situation. So I agree. You can't say to him, it is like delayed, but it's delayed, definitely delayed for the 5 years. He should refer him, because the symptoms, I know it's similar. However, it's long time to not diagnose the resistant hypertension, and giving him certain medication away from his medication. So again, it's medical error, and you can feel sorry to him, and you can say sorry to him. Are you agree with that?
medical error.
Yes. Delayed
No.
diagnosis for 5 years. Why no?
No, not medical error. Here, this is delay diagnosis, just not medical.
So what the meaning of delayed diagnosis?
No. Delayed, just delayed, and take a time, not medical error. Medical error means he received something wrong.
No, it's not only concerned to the medication error. Medical error, even the delay diagnosis considered as medical error.
You can say negligence, يعني not if you
So
said
what's the
medical.
negligence? The same, the negligence also
If
is
you
an error.
if you take this scenario medical error, you need to apologize. You need to.
I
Uh,
told you, yes, you will say sorry to him. You will not apologize for the GP, you will apologize for what happened to him. You got it? Because the GP is not of one of your team. The GP is not
no,
one of your
no,
team,
no.
right?
والله, actually, I attend this scenario, same scenario as I sent to you with Dr. Hussam.
Mm-hmm.
I write everything. First, he said to him, "Thank you for sharing this me with Mr. John. I'm really sorry for what happened to you. Uh, regarding your concern, يعني negligence, there is negligence or not. From my point of view, I think the matter is complicated. First, I don't have enough information to be able to tell you where is delay is to reaching the diagnosis was justified or not. Same الرخ. I have not full picture, and I'm not trying to search for justification. I'm not in the position to defend my colleague. However, let me explain to you a few points maybe to resolve your concern. First of all, pheochromocytoma is a very rare compared to white coat hypertension. I understand when you used to go to the GP, you have other manifestation like anxiety. This was justified by the GP by something called white coat hypertension, which is well known and common medical condition in which is a BB reading healthcare office will be higher than the other cities like home. Pheochromocytoma is a very rare compared to white coat hypertension. And since you have you had this anxiety, the GB attributes them to white coat hypertension, which is a more common condition. So when your GB realize that the blood pressure is a very difficult control, uh, he doing something and he did reconsider the diagnosis and refer you to the clinic for further investigation. I'm not telling
After
you
five
that
years,
I'm not telling you that the narrow negligence, but on the other hand, I need you to consider the delay may be justified. However, in case you decide to go for formal complaint, this is your full right. And even if you need help, I will يعني refer you to this office complaint. But this is all scenario. Hope this to be understand the point.
okay,
والله I
let's
think
talk
this
in
scenario with Dr.
scientific.
Hussam.
Okay, I believe. Okay, let's talk in the scientific way. If you have a patient with high blood pressure, and whenever he comes to you in the clinic to measure the blood pressure, it's high. So according to the guidelines, what you supposed to do? Is it home monitoring, right?
See, يعني no one will
So
go for
no, this
no
is also clinical judgment. Yeah,
yeah
Dr. Ali,
see
this is clinical
to be
judgment. Yes.
يلا
So
to
yeah,
be on the same page. The clinical judgment, if I have a patient, he came to my clinic, I will start, for example, 35 year. Usually 35 year, you will go for, or 30, you will go for secondary cause, you will investigate. But will not go for deep يعني. You will do renal function test, you will do serum cortisol, you will do aldosterone, all this. And we will start, for example, amlodipine 5 milligram. If the patient came to you after 1 month again back and the BB is still uncontrolled, you will upgrade the dose to 10 milligram. And even if he still, you will come frequent. You will start, for example, add another ARB or ACE inhibitor. Then you will add indapamide, you will add beta blocker. Lastly, we refer to consultant or nephrology clinic or cardio clinic. And usually will not go for deep investigation. I don't know, maybe make a scenario 5 year, but scenario I think will not come to you 5 year. But Dr. Basim, to be honest, medical error in the exam will come clearly medical error. This is not considered as medical error. If you consider this is a medical error, you will go for other direction. Yeah, we need to apologize. We need to, I will do action. I already my consultant inform, already nurse in charge inform. Wallah, this will make different scenario. We'll lose the scenario, to be honest. And if you do, this is a
But this is not
delay.
only my opinion.
Yeah. No. I saw the other, but usually every rare disease is maybe will take time to delay, even like cancer. Yeah, الرخ he brings this cancer with 2 months, and this Dr. Husam bring with the 5 year. 5 year, Allah, I think too much. Yeah, as you said, but even no need to make as medical error because this disease is very rare. يعني see now this is الرخ 2 months as a GB, not consider him as the GB medical error because the GB has limit for investigation.
Okay, Dr. Ali, let's talk about the scenario from the duration and the period point of view, okay? If it's
Yeah.
like 6 months, I think the scenario came also in another way. It was 6 months. And in
Yeah.
this scenario, 6 months, I will consider it as not as a delay, not as a medical error, because 6 months, you might take some time to reach and to refer your patient. But
Yes.
for 5 years, it's clear that it's very long time to be delayed, and it's 100% negligence. So if the duration will be less, like 6 months, I agree with you. All what you said, I agree. But for the 5 years, I'm not agree. The same point also, I think others sharing their comments for the same point and the same concept. 5 years is so long. So I think that the scenario also will be drive different way. Okay, but in this way, 5 years, it's so long. So you can apologize for that, feeling sorry for the patient, sympathy and empathy, and we will follow up you. We will try to do the best management for you, best in the best interest for you, and to reassure him. This is my opinion. But if 6 months, I agree. You can defend your colleague at even. You can defend your GP if the 6 months delayed. It's not a delay. You can say, as you said, there is mimic condition, mimic symptoms similar to each other, diseases similar to each other. Since you are going to your GP in a stressful condition and he's measuring your blood pressure, the blood pressure comes high, but when you go home, it's different. So this is the white coat syndrome. And in your condition, yes, I can think about this condition in the top of my differential. But after, for example, 1 year or 6 months, if this GP didn't refer that patient, I consider him is neglecting his patients, and it will be like medical error. How about 5 years? So the scenario, I think, will be different between 6 months or 5 years. Let's have a deal for that, okay? Okay, Dr. Ali, agree? Even 5 years, we can't decide by ourselves that it's an error, because once you decided an error, you need to mention about all apology. Yes, we are doing that because 5 years is so long, doctor. I'm not. All of us agree for this point. See, starting from Dr. Rhoda, sorry, Dr. Amna said, yes, this scenario is medical error. Dr. Hadil as well, this medical error. Sorry. Dr. Rhoda, I think in this kind of scenarios, we should show more sympathy and apology and keep neutral, leaving it for further investigation and assure patient if any negligence discovered, we are going to take it seriously. Yes, I agree. But again, you are trying to be diplomatic and neutral, as you said, Dr. Rhoda, but still, you will be more at the side of negligence. Anyway, you can say that this answer is diplomatic, a diplomatic answer. Okay, but 5 years is so long period, Dr. Hatton. It seems as medical error. Yes, I agree. Dr. Rhoda, someone I don't know the name. It's uncertainty. I think also error in scenario will be clear. They will not leave it as puzzle. I think this scenario is not as we mentioned. I think it was 6 months. So the 5 years, maybe someone make the duration longer. But in 6 months, yes, I agree for all what Dr. Ali mentioned. I attempt also this scenario with Dr. Hussam, but different in scenario is long time. Yes, I agree. So this is also the same opinion. Even 5 years, we can decide it ourselves. This is an error because yes. Okay, so as all of you said, in the scenario in the exam, they will mention to you the task and the category of this scenario will be written in the paper as medical error. For example, if medical error, they will mention medical error, and you will follow the all steps of medical error. They will not give you scenario vague, but in such kind of scenario with long time, I agree again to be medical error if 5 years. But if 2 months, let's discuss about the previous scenario. Why we didn't consider the previous scenario of cancer within 2 months as medical error? Because it's short time. Even the patient has the symptoms in the 2 months window, but still it's short time. I can't blame my GP for 2 months. Maybe in this 2 months, I will visit him twice or thrice, for example, or 4 times. But still, it's not that much long. Are you agree with me? Yes, always trust. Yes, I agree, Dr. Ali. So the scenario will be clear either for medical error or for angry patient, breaking bad news, or whatever the task in the scenario. Okay, I don't want to be lengthy talking. If any question about the two scenarios, the previous scenarios, any question, any inquiry?
يعني the objective هنا دكتور باسم of the two scenario, the objective of both two scenario, you need to tell the patient there is something disease, share same symptoms.
Yes, this is the take-home message. Yes, yes.
Yes, yes. Other thing, I don't know the whole the situation, why the GB is thinking about this. Maybe has justifiable. I need to know the situation. Second thing, I'm not defending on my colleague. When he said I need to complain, you tell him you have a full right to complain. But
Yes.
I need to reassure you, this is sometime happen in our practice because there is same disease, share same symptoms.
The
And
same
يعني,
presentation.
for
Yes.
example, yes, for example, if Pheochromocytoma, when he consider his diagnosis, reconsider, he refer you to the us.
Yes.
This is a very rare disease like this. بس خلاص يعني this is like this. And in the cancer, as I said from الرخ يعني I bring from الرخ direct. We need to tell him
Yeah.
usually same manner يعني same manner.
Yeah. Yeah. You're right. This is a take-home message. Just show the point of the sharing symptoms or the sharing the presentation of the same disease. One of the causes of not delay, but one of the causes not to confirm the diagnosis from the first impression. We
Yes.
have to have time to do some blood tests, to do some scans, and the GP did his best to reach and to find out your problem and the cause of your problem. However, yes, there is some similarity between the condition and the diseases. And after some time, and when he have no explanation for your symptoms, he refer you to us, and we did our best to find and figure out the main problem for your condition. This is the take-home message, and try to be neutral, as Dr. Roda said. I'm not defending him, and in the same time, defend him in one sentence, like what I said. He did his best to try to do, but there is certain condition similar to each other, and so on. And if he insists to complain, yes, don't stop him. This is his full right to do, and he can do that with the GP surgery, and the investigation will show. Any negligence, don't worry, we will take it seriously, as most of you said. Okay. Any other comment or yeah? Thank you, Dr. Ali, for this scenario. I know this is the most difficult scenario in the communication because it's not clear. It's not clear toward the medical error side, and it's not clear that the GP did everything and he was 100% correct. So it's like gray zone between both categories, and you are the one who will judge about that, either error or not error, and the patient will come to you like victim, and
Okay,
you
okay.
will try.
Next time, inshallah, we will discuss medical error. We will bring scenario,
Yes.
for example, medical
Okay.
error.
Okay.
Okay,
Okay.
thank you, Dr. Basim.
Yeah. Thank you, Dr. Ali. Thank you, all of you. Thank you, Dr. Aisha. You commented earlier, but I don't know, maybe, yeah, still you are there. Thank you anyway for your comment and for your sharing. Thank you, Dr. Roda, as well, Dr. Hadil, Dr. Hatem, and all of you. If no more question and concern, we can end this session. Anyone has comment or question? Be sure that the debate and
I
this
shared a
conflict.
similar scenario from Ryder.
Mhm.
Just try to read it, the
Okay.
comment of Ryder. Okay.
Okay, Dr. Aisha, thank you so much.
Thank you
Again,
for your-
yeah, thank you. I'm repeating this sentence. The conflict and debate make the scenario more clear. I think after all this discussion and debate and conflict, the point of delayed diagnosis is clear for all of us. I hope so. Okay, thank you, Dr. Hadil. Okay, if no question, we can end this session. See you tomorrow. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.